Hello, my name's Gorna and I'm the Executive Director of the Partnership for Maternal, Newborn and Child Health. And I'm talking to you from Copenhagen, Denmark. We've just ended the 4th Women Deliver Conference, and what an incredible 3 days we've had. It's really been an exciting event. I want to congratulate Katja Iversen and Jill Sheffield, the founder of Women Deliver. They are remarkable women, and they brought together over 5,500 activists, policymakers, funders concerned with women and girls from all over the world. And for us at the partnership, we had a great time making sure that people really knew about the global strategy for women's, children's and adolescents' health and how important it is to have that right at the centre of the SDG agenda. There was a huge amount of discussion also about education, water and sanitation, nutrition, gender equality more broadly, just tons of energy to help us to really understand what we all need to get focused on. We organised a side event with the Lancet and the Bill and Melinda Gates Foundation that looked at all the different pieces of evidence, the new learning that we need to lean on to make sure we take forward the work in the right way at country level. And there were hundreds of countries present. In addition, there was a lot of discussion about humanitarian and fragile settings, really important on the eve of the World Humanitarian Summit. And over 20% of the delegates were adolescents and youth, bringing their unique energy to fire us up to action. The week before Women Deliver, there was the launch in London of the Lancet Commission on adolescent health and well-being. We have 1.8 billion adolescents and young people on this planet. That's the most ever in history. And you know, the majority of those young people, 600 million, live in the least developed countries that face the biggest challenges to their economy, their health and their social infrastructures. What's so phenomenal about this commission is that they've spent a couple of years gathering all of the data and research that there is on adolescent health and well-being. One scandal is that there's actually not very much, but the analysis they've done really shows the complexity and variety of health needs that adolescents and young people have, and it shows and charts the way forward. We know we must invest in adolescents and in young people. They are our future, and where we invest in them, where they are healthy, they build societies, they build economies. There's a huge number of recommendations in the report which I really commend to you, and one of them is that we must meaningfully involve young people and adolescents in the centre of our work. We must bring them to the table. They must have power like their elder colleagues. And I'm really proud that Yemarai Nyoni, who sits on our board and our executive committee, and I were able to be there. And I was just so pleased that our adolescent and youth constituency in the partnership is held up as a model of good practice. The end of this incredibly busy week in Copenhagen is the 18th board meeting of the partnership. We're honoured to have opened the meeting with addresses from the Federal Health Minister of Nigeria, Professor Isaac Adewole, and the Honourable Minister from Tanzania, whose portfolio covers health, gender equality, children and the elderly, Umi Mwalimu. Both ministers gave us really deep insight into the challenges and opportunities in their countries and their deep personal commitment to advancing the health of women, children and adolescents. And it's fantastic that our board meeting has been grounded in those country realities as well as graced by such important colleagues. We were also delighted to have a global overview provided by Dr. Richard Horton, the editor-in-chief at the Lancet, and he really reminded us of the urgency of moving from planning to action and taking active responsibility for ensuring that our 750 partners really work together as effectively as possible to change the lives of women and children and adolescents. We're coming to the end of an incredibly exciting week in Copenhagen, and I'm coming to the end of my time leading the Secretariat of the partnership. I'm really excited to be refocusing my energies and my attention where it matters most in my life. And in a couple of months' time, I'm going to be working with the Lancet to set up a new commission looking at how we can address health through all 17 of the SDGs. So I'll be watching the partnership's work from a little distance, and I want to thank all of the partners, the Secretariat team, the donors, and everyone involved in our mission. I remain passionately committed to the vision of the partnership, and I wish you all well.